Hello, 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 ladies and gentlemen. Tonight we are talking about infectious diseases, and this is not the full PowerPoint with the voiceover. This is simply a 10-15 minute mini lecture just to review some of the things that we talked about in class that I think are a little important that you might want to review when you're reviewing my content for the exam. Please review the routes of transmission, direct and indirect, contact, airborne, vector, and vehicle. You're going to want to remember those. Please remember that the most common site to swab, to culture for MRSA is the nares. Let's also think about the way this all happened, and that is the overuse of antibiotics and the way overusing them has led to antibiotic resistance. Review the populations that are at risk for community-acquired MRSA. You're going to want to review the risk factors for C. diff. You will want to review the clinical manifestations of A. Baumannii. What does that patient look like? Where is that patient? What is going on with that patient? Also, you're going to need to review the correlation between C. diff and hand washing, and the fact that only hand washing with soap and water are going to remove those C. diff spores, and alcohol rub is not something that you're going to use after you have taken care of a patient with C. diff. Also, please remember that prevention is the best way to decrease the spread of these organisms. And again, that is going to go back to hand hygiene. As far as medications go, please remember that it is vancomycin for MRSA. The medication of choice for C. diff is ampicillin sulbactam. For VRE, the medication you want to think about is quinupristin, dalfomycin. Let us think about C. diff some more and some of the medications, or a medication that you will not want to give. And one of the medications that we're not going to want to give are those antiperistalsis medications. The medication for A. Baumannii is imipenem. And when you're thinking about this patient that has C. diff, think about what is going on with this patient. Think about the fact that they are losing fluids in their stool. Think about hypovolemia. Think of dehydration. And think of some of the nursing diagnoses that may go into the care plan for that patient. And then let's think about the population that will be impacted by CRE. They are older. These antibiotics attack not only the virus or the organism, but it also attacks the normal flora. And how does that impact your patient? And if all else fails and your patient becomes septic, what does that patient look like? And then also review, if your patient has C. diff, please remember that the only way to diagnose this C. difficile is with a stool sample. So you are going to want to review how to collect that stool sample and send it off to the lab. As always, if you have any questions, comments, concerns, please reach out. And again, thank you for your time and attention.